In a notable event, Chief Minister of Meghalaya Conrad K Sangma inaugurated the Northeast TB-Free Summit at the Courtyard Marriot alongside Health Minister Dr. Ampareen Lyngdoh and Dr. Roderico H Ofrin from the World Health Organization, India. The Chief Minister also introduced the state-of-the-art Meghalaya Mobile Portable AI-based X-ray diagnostic facility during the summit. The event saw the presence of prominent figures including Dr. Rajendra P Joshi, the DGB-TB Government of India, Director of NEIGHRIMS Dr. Nalin Mehta, Secretaries of Health from Nagaland and Manipur, as well as representatives from various northeastern states and senior officials from the Health Department of the Government of Meghalaya. In his inaugural speech, Chief Minister Conrad Sangma underscored the government's steadfast commitment to healthcare, highlighting augmented funding towards health initiatives and the establishment of health and wellness centers to bolster primary healthcare accessibility and quality in Meghalaya. He also emphasized the empowerment of women through participation in self-help groups, which he attributed to improved health outcomes. Additionally, the Chief Minister of Meghalaya addressed the pressing issue of delayed tuberculosis diagnosis, particularly among the economically disadvantaged individuals, advocating for community engagement, technological integration and awareness campaigns to achieve India's goal of being TB-free by the year 2025.
Engaged and continuously invested in the health sector on various fronts. And today we have one of the highest budgets in terms of percentage in terms of the entire country, different states if you compare. Meghalaya has one of the highest, if not number one, number two in terms of the percentage that we spend out of our budget on health. Was that we often mistake or we often don't realize what really the problem is. And that happens in governance as a whole. But I think health, it is even more. A simple example of that would be, we often say that Meghalaya's problem is the MMR rate, the maternal mortality rate. And we don't fail to realize, and we have different programs and we try to do different things, and we don't realize that the MMR is actually the result of the problems. It's not the problem in itself. And sometimes in governance, as officers, as politicians, we need to realize that we need to be able to identify what leads to the problem. And in our endeavor to be able to provide better service, better policy making, better administration, unless we are not able to put the finger on the actual cause of the problem, we will not be able to find the right solution, the right policy, or the right steps to move forward.
Meghalaya's Health Minister Dr. Ampareen Lyngdoh echoed the need for a comprehensive preventive strategy and sustained community involvement to eradicate tuberculosis, urging for an expanded presence in tackling tuberculosis-related concerns. Dr. Roderico H Ofrin from the WHO India highlighted that the summit not only celebrates the efforts in TB eradication in the Northeast, but also serves as a platform for sharing best practices and mutual learning across the nation.